In rural and underserved communities across West Virginia, there are people working every single day to support those facing some of the hardest yet least visible challenges a person can face: depression, anxiety, and other mental health and substance use disorders. They're breaking down barriers, reaching West Virginians where they live, often in their own homes, and being that strong hand, helping to guide them toward connections, resources, and improved mental health. West Virginia needs stronger mental health services. We need more professionals working to break down the stigma that surrounds mental health conditions and substance use disorders, stigma that too often prevents individuals from seeking care.
The mental health needs here, we are overrun with substance use disorder. And it's really mainly because our economic base has been hit so hard. Coal has been hit so hard in southern West Virginia. And usually anytime you find poverty, you're gonna find a lot of substance use. And we also do a lot of general behavioral health, depression. Anytime people are not making money and loss of jobs, they're gonna go through depression, especially with COVID and how it has isolated people and kept people from that social connectivity. The barrier, I would say, is transportation. We run into that a lot because we are in such a rural area, but we utilize telehealth quite a bit just to try to alleviate some of those barriers.
Those who commit themselves to this work are determined. They're determined to provide the type of care they know will benefit individuals and families in their communities. Guided by a desire to show others the respect and care they want for their own family members and neighbors who are struggling, these professionals provide therapy and counseling services that will turn their present communities into places where their own children can thrive. Because they understand that when we prioritize the mental health of individuals, the health of whole communities follows.
I am a trauma therapist, but I'm not restricted to trauma only. I work with adjustments. We're going through adjustments very rapidly now. People who are adjusting to children staying home, children going to school. It's the resiliency factor that I'm really focused on. I like walking with people, having them look back to see what they've been through, and only by looking back are they able to find their path forward.
Careers in mental health are not only transforming lives, they're transforming the health of our entire state, one story at a time. Are you someone who has always thought you have more to give those around you? Maybe you've had loved ones facing mental illness, or you've seen the impact of substance use disorder in your own community. Our state's new mental health loan repayment program is one of the ways we're supporting mental health professionals, and we hope it's a signal to anyone interested in this career path that West Virginia wants to invest in you. It takes all of us pulling together to increase access to quality mental health services in underserved areas, to make communities across West Virginia the strongest they can be.